Hey guys, welcome to another video. Today we will be talking a bit about the Spanish flu, also known as the influenza. The Spanish flu was a deadly global outbreak of influenza from 1918 to 1920, infecting 500 million people and causing at least 50 million deaths. This video explores its origins, spread, and impact on the world. So let's get started. So the Spanish flu was a deadly influenza pandemic that occurred in 1918 up until 1919. It lasted a whole year, towards the end of World War One. It is believed to have infected around 500 million people worldwide, which was about one-third of the world's population at that time, and caused the deaths of an estimated 50 to 100 million people. The pandemic was named after Spain, where it was first widely reported, although it did not actually originate in Spain. The Spanish flu was caused by an H1N1 strain of the influenza virus, which is different from the seasonal flu viruses that circulate today. The virus was highly contagious and spread rapidly through close contact between people, often in crowded conditions such as military camps and cities. The symptoms of the Spanish flu were similar to those of seasonal influenza, including fever, cough, and body aches. But the pandemic was unusual, in that it tended to affect healthy young adults more severely than the very young and the elderly. This is thought to be because the virus triggered an overly aggressive immune response in healthy individuals, leading to severe inflammation and damage to the lungs. The Spanish flu pandemic had a profound impact on society, particularly in the areas of public health, medicine, and international relations. Governments and health organizations around the world struggled to contain the spread of the virus, and many implemented measures such as quarantines and school closures to try to slow it down. The pandemic the pandemic also led to advances in medical research, such as the development of new vaccines and treatment for influenza. Overall, the Spanish flu was one of the deadliest pandemics in human history, and it serves as a reminder of the importance of preparedness and rapid response in the face of infectious disease outbreaks. Now, the exact origins of the Spanish flu are still unclear, but it is believed to have originated in birds, specifically in waterfowl such as ducks and geese. The virus likely mutated and then jumped to humans, possibly through close contact with infected birds or other animals. The Spanish flu spread rapidly through human populations, particularly due to the movement of troops during World War One. The close quarters of military camps and the movement of soldiers across borders helped to accelerate the spread of the virus. Additionally, the war may have compromised public health measures, such as quarantine and isolation, which could have helped to slow the spread of the virus. The high mortality rate of the Spanish flu was likely due to the combination of factors. First, the virus was highly contagious and could spread quickly through populations, particularly in crowded conditions. Second, the virus was highly virulent, meaning that it caused severe illness and death in many cases. Finally, there were few effective treatments for the virus at the time, which meant that many people who contracted the disease could not receive adequate medical care. Overall, the origins and the spread of the Spanish flu highlights the importance of understanding the links between human and animal health and the need for effective public health measures to prevent and control the spread of infectious diseases. Spanish flu caused a range of symptoms, including fever, cough, and fatigue, which are similar to the symptoms of seasonal influenza. However, the Spanish flu was also associated with more severe symptoms, such as pneumonia and acute respiratory distress syndrome, which can cause respiratory failure and be life-threatening. The Spanish flu was unusual in that it tended to affect healthy young adults more severely than other age groups, which is different from the most seasonal flu outbreaks that tend to affect the very young and the elderly more severely. One theory for this is that the virus triggered an overly aggressive immune response in healthy individuals, leading to severe inflammation and damage to the lungs. In addition to respiratory systems, some people with the Spanish flu also experience gastrointestinal symptoms such as nausea, vomiting, and diarrhea. Neurological symptoms such as confusion were also reported in some cases. Overall, the symptoms of Spanish flu were highly variable, and the severity of the illness would range from mild to severe. However, the virus had a high mortality rate, particularly among young adults, which made it one of the deadliest pandemics in human history. The public health response to the Spanish flu pandemic varied widely across countries and regions, and the effectiveness of these measures was often unclear. Quarantines and isolation were among the most common measures used to control the spread of the virus. Some countries such as Australia and New Zealand implemented strict quarantine measures that effectively closed their borders to incoming travelers. Other countries such as United States and Canada implemented more localized quarantine measures such as closing schools and banning public gatherings. In addition to quarantine measures, many countries also implemented social distancing measures such as school closures and the use of face masks or covering of the mouth and nose in public spaces. However, the effectiveness of these measures was often limited by the lack of understanding of how the virus was transmitted and by the lack of effective treatments for the disease. Overall, the public health response to the Spanish flu pandemic was marked by a lack of coordination and a lack of effective measures to control the spread of the virus. This highlights the need for better international cooperation and preparedness in the face of future pandemics. Now, the Spanish flu pandemic led to a significant amount of scientific research in the years and decades following the outbreak. This research has helped to better understand the virus and its impact, as well as developing strategies for preventing and treating future flu outbreaks. One of the significant discoveries that resulted from scientific research on the Spanish flu was the identification of the H1N1 strain of the virus. This strain was responsible for the Spanish flu pandemic and has since been found to be responsible for other influenza outbreaks as well. The identification of this strain has been important in developing effective vaccines and treatments for influenza. In addition to identifying the H1N1 strain, research on the Spanish flu has also helped to shed light on the factors that contribute to the spread of influenza viruses. For example, researchers have found that the virus can spread rapidly through populations in crowded conditions, such as military camps and cities, highlighting the importance of social distancing measures in controlling the spread of the virus. Overall, the scientific research on the Spanish flu has been crucial in advancing our understanding of influenza viruses and developing effective strategies for preventing and treating future outbreaks. The Spanish flu pandemic offers important lessons for how we can prepare for and respond to future pandemics. Here are some key lessons. First of all is early detection and rapid responses are crucial. The Spanish flu pandemic spread rapidly due to the movement of troops during World War I, highlighting the importance of early detection and rapid response in controlling the spread of infectious diseases. Today, early detection and rapid responses are still crucial in preventing the spread of diseases, and global surveillance systems are in place to detect and respond to potential outbreaks. Second, effective vaccines and treatments are essential. The development of effective vaccines and treatments is vital in preventing and treating infectious diseases. The identification of the H1N1 strain of the virus responsible for the Spanish flu pandemic has led to the development of effective vaccines and antiviral drugs that can help prevent and treat influenza. Public health measures can be effective in controlling the spread of disease. For example, quarantine measures, social distancing, and the use of face masks were used during the Spanish flu pandemic to help control the spread of the virus. These measures are still important today in preventing the spread of infectious diseases. International cooperation is essential. The Spanish flu pandemic affected countries around the world, highlighting the need for international cooperation in preventing and controlling the spread of infectious diseases. Today, international cooperation is essential in detecting and responding to outbreaks, and organizations such as the World Health Organization plays a crucial role in coordinating global responses to infectious diseases. In conclusion, the Spanish flu pandemic was a devastating global event that caused widespread illness and death around the world. While the pandemic occurred over a century ago, its impact and lessons continue to be relevant today. For instance, with COVID-19, the pandemic has taught us the importance of early detection and rapid response, effective vaccines and treatments, public health measures, and international cooperation in preventing and controlling the spread of infectious diseases. As we continue to face new and emerging infectious diseases, we must remember the lessons learned from the Spanish flu and other pandemics. By working together and taking proactive measures to prevent and control the spread of infectious diseases, we can help to protect ourselves and our communities against future outbreaks. Thank you for watching and please stay safe and healthy. I'll catch you in the next video.